Hey everyone, welcome back to my podcast, On My Watch. I'm your host, Dr. Riz, the place where we kick stress out of healthcare and bring clarity and a little bit of common sense with some chuckles along the way. Well, let's be real. Healthcare feels complicated not because it has to be, but because it has never been built for regular people like us. Most of us walk into appointments thinking, what's wrong with me? What needs to be fixed? Am I going to be incorrectly diagnosed? Hope not. Meanwhile, there's a whole separate conversation behind the scenes, the cost conversation, and patients almost never get invited to that. So, today we're pulling back the curtain. We're talking about the stuff no one really explains, the problems that could actually make everyday healthcare less stressful if someone finally fixed them, and what healthcare might look like if it felt less like a lecture and more like an actual back and forth conversation. When we fast forward a few years, healthcare shouldn't only try to keep us healthy. It should respect our time, hear us out, and not make us afraid to open the medical bill. Luckily, we're not doing this alone. We have got someone special joining us today who can walk us through it. Our guest today is a true force in healthcare, Dr. Cynthia Smoak. She is an elite 2-decade veteran of clinical operations, quality, and healthcare administration, holding a distinguished doctorate in healthcare administration as well from the Medical University of South Carolina. Dr. Smoak currently commands the helm of enterprise clinical services for a leading managed care organization, where her expertise is not just about management, it's about shaping system-wide strategy and defining the future of patient care. Now, that's a very important role to have. But her influence extends far beyond the boardroom. She dedicates her time to mentoring the next gen as both a graduate professor and as well as a doctoral advisor. Previously, she was the key architect in fixing the complex clinical data problems that keep most people up at night, while leading major quality operations at Optum Care. She has a proven record of boosting HEDIS performance, guiding providers to improve care, and working hands-on with doctors to close critical gaps in patient care. Please join me in welcoming the exceptional Dr. Cynthia Smoak.
Thank you, Riz. I appreciate that welcoming.
So excited that you're here with us today, Dr. Smoak. So, folks, honestly, I get it. It's about treating healthcare like a chat over coffee, not a lecture from a textbook, right? So, patients should feel more comfortable and confident asking questions, and because ultimately it is about their health, right? If we combine that with tools that make costs more transparent, everyone wins. Fewer surprises and fewer unnecessary procedures. So let's dive right in, as I have some questions for you, Dr. Smoak, and I am so looking forward to your insight. You worked deep inside the healthcare system. What's one truth about the healthcare that patients would probably want to know, but hardly hear about it, more in terms of clinical services versus cost?
So, the one truth patients rarely hear is that clinical excellence does not always align with cost efficiency. The administrative and financial structure of healthcare is so complex that a necessarily high quality procedure can cost 5 times as much more at a hospital a mile down the road than it can an outpatient center. Even the same doctor. Patients need to understand that a provider's clinical recommendation is often separate from the administrative machine determining the final bill. Being a smart consumer means that asking about both the necessity of the procedure and the expected out of pocket cost. So, one of the things that we have to take into account is this procedure necessary? And what are my out of pocket expectations? So, if we ask that to our providers, You probably won't get an answer because providers are definitely on the hands-on care piece. When we talk about cost, they're going to turn you over to your administrative personnel. You need to ask about that because a procedure in a hospital can be 5 times more expensive than a procedure in an outpatient clinic.
Absolutely. The place of service is very important. So true. And nearly every clinical decision has a cost side to it. Doctors, clinics, and hospitals aren't just thinking about your health, they also have to navigate insurance rules, coverage limits, billing structures. Therefore, we suggest that understanding that cost component can help people ask the right questions and make smarter choices about their care. Because there could be less expensive alternatives as well, like laparoscopic or minimally invasive surgery versus a regular surgery, physical therapy in lieu of surgery. Things to consider when asking questions. Okay, that's perfect segue into my next question. So, Dr. Smoke, if you could channel your inner Wonder Woman for 24 hours, what's the one healthcare problem you'd pounce in and solve? And how will that impact an average American?
I love this question as it is vital to what I do with Optum. And so, if I had 24 hours, I would solve data fragmentation and interoperability. I would mandate and implement a universal, secure, and instantly accessible electronic health record system for every American. The impact on the average American would be profound, eliminating millions of hours and billions of dollars in administrative waste, preventing duplicating testing, reducing medical errors during care transactions, and speeding up the time to diagnosis in emergencies. It would make care seamless and safer. Think about all the times that you go into a doctor's office and they ask you for your basic healthcare profile. And then you get passed off to the nurse and they ask you again the same questions that you just answered on your piece of paper with your check boxes. Again, wasting time and administrative effort. And then the doctor comes in and they haven't had a chance to review that file. They ask you the same set of questions. So, what would it be if we had one seamless universal medical record that could save that administrative waste and you don't have to answer those questions 3 times? That's something that I'm trying to do with Optum, and I feel that other major health insurers will get on board across the United States to make sure that we have that same seamless effort and safer care for all of our members that we serve.
I love your response. Unifying the healthcare system with electronic health records can have a phenomenal impact that will cut the healthcare costs by reducing duplication of services, first of all, right? Like you said, rightfully, and result in better care to patients by being able to view their comprehensive medical history. And imagine being able to share the treatment plan with other providers for better care. That's a win-win. That's a definitely, a very good, insightful response. Okay, this is my futuristic question. So let's fast forward a few years, hopefully before the robots take over, right? So, Dr. Smoke, how do we make healthcare less like a lecture and more like a conversation where patients actually feel heard while being saved from unnecessary bills and treatment?
To shift from a lecture conversation to more of a natural, realistic conversation with our patients, we must transition from a financial model from fee for service to value based care. This aligns compensation with patient outcomes and time spent, not the number of services or tests ordered. For the patient, this means that the doctor is financially incentivized to listen. We can also leverage technology like AI to handle the paperwork, freeing up the physician to focus on the patient. Critically, every consultation should conclude with a plain English summary and an estimated cost of care disclosure for any recommended next steps.
That's tremendous. Great insight. So, AI can help this model of pay for performance by automating tasks, analyzing data, supporting like decision making, ultimately improving both efficiency and patient outcomes in terms of their health. And just to be clear for the audience, AI can make a recommendation that the physicians or healthcare leaders can then take a closer look at to decide whether that should be implemented as opposed to AI blindly running the show, because that's certainly not the intent.
You're right, Riz, there. We are implementing AI on our end on how we lead patients to move forward within their medical care. It is up to an actual provider. It could be an RN, it could be an APC that has to check that box that they've reviewed AI and they agree with that, or that they can make modifications. I don't want to give this a false sense of insecurity that AI is going to run someone's healthcare. We still have that human component that says, hey, yes, I agree with that. I just didn't have to think about it.
We certainly need the empathy and care in healthcare for sure. I totally agree with that. Okay, so now we're going to switch to the young and the invincible audience. So, got a couple of questions because I know that they are definitely the future of this country and as well as healthcare. So, it's definitely worth addressing some of those questions here. So, to avoid future medical drama, if someone in their 20s or 30s want to dodge health headaches down the road, what's one smart move they should start now besides, putting down their phones because that might cause a riot, right?
It's funny. hmm So, the single most important action is to establish a relationship with your PCP, your primary care provider, and attend one basic preventable checkup. This is a crucial step in both health and financing your healthcare literacy. A yearly check-in just establishes your baseline health metrics such as your blood pressure, cholesterol, and when you're healthy, it is a much easier way to manage a potential issue and have an established medical home, turning a future emergency into a manageable relationship with a trusted professional. Van Crossway is important.
I see your dog's part of the podcast. I love it. Well, I totally agree, Dr. Smoke. I spoke with a few people in their 20s and they feel if they can like have a virtual option to see the doc, like teledoc or whatnot, then they would probably keep their appointments given they are reminded via text. So don't call them to remind them for an appointment, please. Some feel that a monetary reward from their employer might incentivize them, and a better relationship with their doc will also help. So these things definitely would help these youngsters to get more engaged with their healthcare. 20s and 30s is the time we are laying the foundation for our health habits. The behaviors that we develop during early age will usually stay with us throughout our life. So it's very critical that we take care of our health, which is very important. Well, let's face it, right? So a lot of young people avoid checkups like their chores. If healthcare could make them fun, easy, or even like Instagram worthy, what's one thing it could do to get them in the door?
So I think healthcare needs to reframe itself as proactive wellness rather than a repair shop. So the key is to integrate checkups with the technology they already use. Imagine a health score or body resilience rating tracked via wearables and gamified apps. The annual checkup becomes the most important appointment of the year. It's the authoritative data point where physician reviews personalized data trends, offers optimization hacks, and gives you a definitive boost for your health score, making it powerful, shareable milestone in performance in longevity. So one of the things that I do that I love is I have a scale that measures all the things. It measures not only my weight, but it measures my body fat percentage. It measures my bone mass. It measures my fat density. I like at the box at the end, it measures my true age. So, or my body age, my health age. So I always want to make sure that my body age is less than my actual age. So right now I am 5 years less than my actual age. And I love the fact that I have this measurable device that tells me how I'm doing as far as my healthy components. That, along with my lab work, allows me to know, hey, yes, you're moving in the right direction. So I would totally recommend people stay on top of that annual lab work, annual PCP visit. You can do it over telehealth, but make sure you have those variables that say, hey, this might be off. I think it is so vitally important.
Wow, it's like how you introduce the health score to make it meaningful. Hitting milestones is always encouraging and keeps us engaged, and a great way to like resonate with the younger generation. The message here is that you go to see the doctor not because something is wrong, but you go to keep things in check. That's important. We can always get influencers to help start a trend, the annual physical challenge. I don't know, something along those lines, I guess. And while we understand that healthcare's future isn't all sunshine and rainbows just yet, things are heading in the right direction of customized care and more provider engagement. And I'm confident our younger viewers will help move it even better. And that's pretty much a wrap for today. Huge thanks to Dr. Smoak for giving us a peek behind the curtain of healthcare and showing us how it could actually work for regular people. Remember, healthcare doesn't have to be scary or confusing, and the future is looking a lot more patient friendly. So remember, don't be shy to ask your healthcare provider questions because we are talking about your health, which should be the most important thing to you. If today's episode made healthcare feel a little less intimidating, share it with a friend who keeps putting off that doctor's visit. You know who I'm talking about. Happy holidays and Merry Christmas. This is Dr. Riz with On My Watch, reminding you to stay informed and stay out of trouble. Catch you next time.